Hello guys, now thorax. In thorax we must remember that costo means rib. Wherever you find the costo you can replace the word with a rib. Now surface landmarks. Jugular notch means it is the suprasternal notch, means on the sternum there will be a notch that is called suprasternal notch. Angle of Lewis is nothing but sternal angle, and second rib and intercostal muscle lie at this level. Okay, the plane passing through it separate the superior and inferior mediastinum, and the arch of aorta starts and ends here like this, and the trachea divides into two bronchi in this way, and the pulmonary trunk divides just below it this level, means like this, and the thoracic duct crosses from right to left and reach left at this level, means from right side to it will cross to left and reach to left there. It marks the upper limit of the pericardium and entry of the superior vena cava into the pericardium. The cardiac plexus is situated at this level. This is the main point. And now xiphosternal angle, xiphosternal joint, also called infrasternal angle or subcostal angle. The depression in the angle is also known as epigastric fossa. What is xiphosternal joint means? Xiphoid process on the body of the sternum there will be a joint that is called xiphosternal joint. And the costal cartilages, totally there are 10 costal cartilages. Among them 7 are directly attached to the sternum and the remaining 3 are attached to the 7th costal cartilage. Secant costal cartilage bound to the sternal angle, means it is present at the junction of the manubrium and the body of the sternum. Now 7th costal cartilage bound to the upper part of the infrasternal angle, means it is at the junction of the xiphosternal joint. Okay, it is at the xiphosternal joint. Now 10th costal cartilage form the lower part of the costal margin, means you can see in this way there will be a costal margin. Now there is the lower border is formed by this 10th costal cartilage. Ribs, scapula extends between the second rib to the 7th rib. 11th rib is longer than the 12th rib. Both of them are not seen from front, means they can be visible only from back. Now thoracic vertebral spines. Vertebra prominence means it is the first cervical spine, first prominent spine felt on the lower part of the neck, that is C7, means it is a C7 spine. Below C7 we can palpate the thoracic spines. Okay, we can palpate the thoracic spines. Third thoracic spine indicate the level of root of spine. Okay. In the same way 7th thoracic spine indicate the level of inferior angle of the scapula. Okay, next వచ్చేసిన తర్వాత soft tissue landmarks. Nipple means it is present at the 4th intercostal space in males and position varies in females. Apex beat is probable cardiac impulse in the left 5th thoracic interspace. 5th thoracic interspace. Trachea palpable in jugular notch, suprasternal notch. Okay, midclavicular line. Midclavicular line means vertical plane passing through the inguinal point and the tip of the 9th costal cartilage and middle of the clavicle. This plane is called midclavicular line. Mid-axillary line means vertical plane passing between the two folds of the two axillary folds. Scapular line. What is the meaning of scapular line? By scapular line means it is the line passing through the inferior angle of the scapula. Now skeleton of the thorax is made up of, it is osseo-cartilaginous. Osseo means bone, cartilaginous means it is made up of cartilage also, and formation is anteriorly by the sternum, posteriorly by the 12 thoracic vertebrae plus intervertebral disc, and sides is by the ribs, 12 ribs and their cartilages, and the joints present are costovertebral joints and costotransverse joints and costochondral and manubriosternal joints. These permits the movement of the thoracic rib cage during breathing.